Welcome back to Boost and Balance podcast. It's where beauty meets brains.
I'm Becca and this is Brittany, and today we're going to talk about stem cells and differentiating why you need stem cells versus exosomes and what all they do together.
So regenerative medicine and stem cells have been a huge topic on social media, on the news. We're hearing all about this regenerative medicine side, how our bodies can work for themselves. That's why Sculptra and those biostimulators are super popular too. And we've got influencers and celebrities also going more this route. 2025 is the year of being natural.
Yeah, doing less and getting more.
That's right. And then working towards the future instead of just right now.
Exactly. Which I love that. I'm so excited that people are actually looking to let their bodies do what it does naturally and just aiding that instead of trying to completely
the easy fix stuff, because it's just a never-ending problem because you're never actually resolving anything. You're just putting band-aids on. So it's nice to see that this stuff is becoming more popular and people are actually interested in the education on it.
Yeah.
So that way it makes our jobs easier when we bring this forward and you're like, oh yes, I've heard all about this. So lack of education is the biggest, hurdle, and that's what we're trying to eliminate and make you feel better about making choices that are best for you. So with that being said, today
there are many different, first off, stem cells it's a whole thing. It's a whole thing to begin with, and knowing when to use stem cells versus exosomes, what the growth factor does once it's introduced into the body, like knowing the process of that helps with choosing which one is best for each treatment.
Right. And then having some baseline knowledge will help you too, because we've even had companies express that their product is better over, like we have a stem cell in our clinic that we utilize, and we have another person trying to sell us just exosomes, not stem cells. And she claims, well, it works better than the stem cells. Well, not for everybody. And that's what we're trying to, just bridge that gap in between actually understanding what a stem cell is, what a exosome is, and what a growth factor is, and why we would use those and which one's best for you.
And look, do you remember in nursing school we used to make analogies or things that would help us remember all the things? Mnemonics, yeah. Correct. So we've kind of sort of made one for stem cells that kind of helps with the explanation of what all they do.
Yes. So for me, that's literally how my brain works. And how I explain to patients, because I put it in layman's terms. If you get too technical with it, they're not going to understand. It's not their job. It's our job to educate them in a way that they understand why they're doing what they're doing and that they understand that it's best for them. So let's get started with stem cells. So stem cells are actual raw materials from the body, okay? These are living cells. They come from bone marrow, fat, what else?
Umbilical cord.
Umbilical cord, that's the one we have.
That's the one we have.
What else? Umbilical cord. So they come from actual tissue. It's a living, brand new cell, okay? It has not been damaged. Nothing has happened to it. So we're considering this guy the CEO of a company, okay? So we'll start there. We've got the stem cell, who is a CEO.
Well, then you have let's talk about what exosomes do. So you've got exosomes, and exosomes are a part of a stem cell, but what they do is they are like the manager of the business. The CEO comes in and he's like, hey, these guys are not doing what they should be doing. They're all damaged. They're not working correctly. So then the CEO brings the exosomes with him. The exosomes is the manager. He's here to hire, fire, get rid of, whatever he needs to do.
Fix the problem.
And the exosome goes and it's the messenger. So what it's going to do is seek out these areas and tell it to activate whatever it's damaged in a way.
So you got your messenger, who is your manager, and you've got your CEO. So the CEO has all the tools to make this guy to be able to do his job. So without him, he doesn't exist. So we're not giving you a stem cell, we're just giving you an exosome. That means your body is using its damaged stem cells that it already has, and we are telling it to, hey, there's some new messengers, there's a new manager. We've got, the old one wasn't doing his job, so we've got this new guy, and we're sending him out to that area of a problem. So, and we'll relate this to the body in a second. We're just trying to make you understand. So now we've got CEO, stem cell, manager,
that's your exosomes,
and then your growth factor.
So your growth factor is like your little worker bees. They're the employees that get all the work done. They do all of the regeneration of tissue within the body. So it is basically, think of it like this. The CEOs come in, he realizes, all right, I have all the tools to make my company work correctly, but it's not. So I'm going to send my messenger exosome out to find all these problems, and then I'm going to fix those problems with the messenger, and then the growth factor is going to implement the work that the other two want done, essentially.
And what the stem cell, the CEO, can do is create any position he needs in his company to make sure the company is doing what it needs to. So if he needs healing properties, he needs exosomes, he needs growth factors, he can create these things. He goes to the area of a problem, so do damaged tissue, and sends out messengers, exosomes, growth factors, whatever the body needs. So that CEO has the ability to create these new employees, whether it's a manager or it's, the growth factor, which is just our regular employees. So just remember, he's the mother house. So now let's talk about that in the medical field and in aesthetics and why it's so important. We do regenerative medicine here. We do joint injections. We have people coming from, physical therapists that have torn or had surgery, knee replacements, and they have severely damaged tissue.
So let's think, would an exosome be good to use in that area for that? Not necessarily. The tissue itself is damaged.
So the business is on fire. The manager is not going to want to handle that himself.
Exactly.
He wants to call the CEO and be like, hey,
I need help.
This place is on fire. I need some direction or I need some help. So yes, if it's a big job, a repair job, something that needs new cells because they have been completely damaged, your stem cell's your guy.
Exactly. Now, let's say you're doing something as small as hair restoration. Okay, the tissue itself is fine. It's not that you're needing to regenerate new tissue there. So it's going to be better for more like an exosome. It's more than likely a hormone issue or something that is not being signaled to that area to grow hair. So it just needs a little help with that.
To wake those employees up and be like, hey, you're slacking. Let's do the job. And plus, it's a superficial. So the deeper you get also in damaged tissue, the more work you're going to need, the stronger of the employee you're going to need. So that CEO, that stem cell, is for those deep tissues, those deep repairs. And then as we get more superficial, we can go out and do a stem cell.
And a good way to think about it.
Cell. We can go out and do an exosome.
Exactly. So the way I tried to teach myself and think about it when we were training for the joint injections and things like that, one of the main things, the only contraindication to a joint injection is when it's bone on bone. You have to think about that. There's no tissue there to repair. There's no employees. You can't make a business work when it's an empty building. Yeah. And that's something you have to
even have a building to put
exactly. You have no building. You have no structure there to rebuild. So that's something to think about too whenever you're doing these things. Help yourself. Know when they work best, what is utilized best for what service to get you the best results as well. In a joint, for example, my husband, he had an injured shoulder, but it wasn't quite to the surgery point. He still had some tissue there that could be regenerated. So they actually suggested 2 to 3 stem cell treatments for that instead. But that's the thing. You can't just have one. You need more than likely, depending on the amount of growth factor or live cells in that stem cell.
How damaged those cells are and how much repair they need.
This is so true.
Same thing goes with building collagen. And this is what stem cells do as well. It builds collagen because it's repairing tissue. So it replaces something that the body has lost, which collagen is one of the main reasons why we use it in aesthetics, is because we want to reduce and stop aging, right? And put back what our body has gotten rid of. So
microneedling. Let's talk microneedling, where we are introducing and creating a small trauma, a small wound, which right out the gate, that's going to make your immune response kick up. You get that inflammation that we want. It sends all of the good messengers out there. Then you put stem cells on top of that are undamaged, amazing new employees, and they're going in and they are ready to work and they're ready to regenerate. So you already have this small tunnel that you're funneling them down into where the issue is. And then it's going to work even better than what you already have works.
So for our clients with, reduced collagen and aging issues or acne scarring, we choose a stem cell over an exosome because it's severely damaged tissue and it actually needs those properties back because they're no longer there. So if the tissue is damaged beyond what we can physically repair topically, then I am going to go and use a stem cell because I know internally I need to fix the problem. Now, that can pertain to acne scarring too. Say it's, not deep pitted acne scarring, but it's more superficial. They've done treatments already. Then an exosome would be a perfect thing for that topical area.
Like you said, depending on how bad it is,
right,
whenever they're presented to us.
So it's your injector or your practitioner's job to know when they're examining you, first off, what caused that issue? How long has it been there? Because that matters too. Is it new? Is it old? Obviously, if it's been there for a long time, it's done all it's going to do. It needs some more help. I have a patient currently that has a deep scar, and she's had it for 15 years.
A long time.
And we have broken up that scar tissue and used stem cells to replace new tissue and build collagen and get rid of that underneath damage, and it's done wonders. And now we're going to, for that surface area, we are now going to use exosomes with microneedling just to finish what we want with the skin. We want to brighten the skin up and get rid of texture. So now that's where exosome is going to shine.
And something else to think about as a provider practitioner, let's say you have an autoimmune client come in. Mm-hmm. You want to think about reaction. You want to think about how are they going to handle the product themselves, which we do with all of our products. So just to maybe keep yourself safe, they suggest that exosomes are a better start for them because it's not as much shock to the body, and it's going to help them
working with your stem cells, your body cells to regenerate and repair versus putting a fresh cell that the body could reject. So this is a living cell, so kind of like a vaccine. You can think of that like a living vaccine. We have certain individuals that we wouldn't give those vaccines to. The same thing with the stem cells. If we've got contraindications on the body, especially risk of the body, declining this or
a potential of a high immune response.
Right.
Yeah.
We don't want that. So we're going to baby step into it and use exosomes, and we do have topical growth factors. Although exosomes are the stem cell is going to create both, the exosomes and the growth factors. We then want to add more growth factors because if those cells are damaged, they're currently not doing what they're supposed to. So they need a little extra. So we can throw a little extra growth factors in there.
Exactly.
And then let's talk about those growth factors again.
So with growth factors, so basically what we talked about, these guys are the worker bees. They're the ones but really the messengers are the ones that determine what the growth factors are going to be. Actually, the stem cells tell the messengers to tell the growth factors what they're going to be. So it can be muscle, it can be bone, it can be cartilage, it can be, what I think is the coolest thing. It is a cell that can pretty much mutate into whatever it wants to be. Not only that, it can differentiate a damaged cell from a healthy one. Mm-hmm. So it's going to leave your healthy cells alone, and it's going to attack the ones that are damaged and try to create whatever it's lacking to get it back to par.
It's amazing.
That's so cool. That's and something I learned is like when you're pregnant. Let's say I'm pregnant and I have everything was fine when I started the pregnancy, but now all of a sudden something random, my liver is not acting correct. Your child will send out stem cells from within the womb to your liver to fix those things. And that's kind of how this was found, is that was happening. Pregnant women were getting better, and it was happening naturally because the child is trying to survive. Right. Without its host, it cannot survive. And that's the same situation for us introducing stem cells now. Our body wants to survive. It wants to live. It wants to regenerate. It wants to do that, but it can't do it naturally. So that's what stem cells do.
The cells are too damaged. They're too wore out. They physically don't have the capability to do the job being asked. So we have to put those young guys in. It's like older employee you're asking to pick up all this heavy weight that has had back surgery.
Exactly.
He can't do it.
It's impossible.
So we have to get the young guy who has no back issues in there to do the job safely. And so that is what these things offer. And it depends on what we're attempting to treat, and we'll kind of break that down even more so, just an understanding. So hopefully you kind of understood now. You've got your CEO, your stem cell, you've got your manager, your exosome, and then you got your worker bees, which are your growth factors. So let's talk about what treatments would be best for what. And we've got a little list here. We can just read off like your skin rejuvenation, hair restoration, and post-treatment healing. So something superficial, exosomes.
But in my opinion, like you said, skin rejuvenation, that depends on if the skin's damaged. Right. If there's scarring and things like that there, you're going to use your provider brain and realize that, okay, the tissue is damaged.
I think it's saying skin because it's talking about like the dermis and the epidermis.
Correct.
So if it's superficial, the damage is on that surface level, your exosomes are going to be able to repair it. If it's past that point and it's in, connective tissues, subcutaneous tissues, fat pads, stuff like that, then we're going to have to use something that will actually fix the cells that are damaged, right? Because it requires more work. It requires healing from within.
And this proves that for arthritis, severe injuries, or direct tissue regeneration, right. Stem cells. That's what you're going to do.
Skin, exosomes. Tissue, stem cells. Even though stem cells can do it all, if we're just trying to break it down to easy terms, your topicals, your superficial areas, exosomes, the deeper we get, we're going to need a bigger guy for the job. Stem cells, it gets more complex down there. Then for patients looking for no risk of rejection, like we talked about, those autoimmune patients, we are not going to use a stem cell because we don't know, one, if their body's even going to work with it or if their body's going to reject it. So exosomes are safer.
And then recently we had this happen in clinic. Our front desk, her son had a broken ankle.
I was thinking about him when you were talking earlier.
Yeah, he had he broke his ankle. He's a very active boy. He is fixing to get some scholarships to go to college. They did not want him out. So during his surgery, they actually shaved the top layer of his bone off. They applied the stem cell within, so that way it would heal quicker, better, stronger than it did before.
And he's play sports, so he could continue to play sports without having to ruin his career because of an injury. So stem cells have really shown, that change in not damning your future. Yeah. We're getting people sent here from a lot of the physical therapists because they're seeing this damaged tissue not healed properly, or they're seeing now their gait is being changed, or they're not able to bear as much weight. If there's some more things going on in that tissue that we need to recover before they can properly, utilize it with mobility. So we're working hand in hand with a lot of different companies and specialists to make sure that we heal clients from within. And it's a beautiful relationship. There's not a no.
Right.
There's always something that we can do to help. And that's why you need to go to a provider that understands what these things do and what's going on with you, and actually ask your medical history and dives into, okay, I'm not just doing a exosome treatment because I heard it's good for the skin. That's what most of, when we come into these places like med spas, they're like, oh, it's going to make your skin glow. And you're like, oh, yes, but why? Start asking those questions. Right. Why? Because that's important. You're spending $1,200 on a facial. Why?
And that's the thing that I am noticing, which, of course, I do the finances here and I look a lot at money first when it comes to treatments and things like that. People are starting to finally realize, if I put the money towards something that's going to last me more time long term, or they don't understand that it's going to save them money in the end. You're not having to do as much as often. It's not a Band-Aid. You're going straight to the issue. You're fixing the issue instead of just band-aiding things over and over.
And so that's why we also offer like combination therapies with these types of services, because that's why when somebody asks me online, I want to get a stem cell treatment because I seen so-and-so or heard of so-and-so getting it, or I saw it on TikTok. Okay, well, you want a stem cell treatment for what? What's going on with your skin?
For the first time, I feel like ever, we're actually going to the root and we're slowly learning how to turn back time. I feel like we're at the cusp of beginning that process, in my opinion.
And individuals now have access to education on TikTok and Instagram and Facebook and websites. So I feel like you have a better understanding on what you're looking for. A lot of times what gives our products a bad name in aesthetics is because they're not used properly. It's not because they don't work. It's because when they were used improperly, or the treatment plan was not correct. The way that we delivered the product, the individual we delivered it on, the type of product we choose, all of these things matter so much in order to get the results we're looking for. So you need to make sure as an individual, and especially because you're investing in yourself, your health, the way you look, and your money and your time, you want to make sure you're going to an individual that knows what this stuff is, what it means, and sits you down and does a full exam. Doesn't just give you a price online, because they don't know what you need until they get you in and they talk to you. So a consultation is always needed when talking about these products.
Completely agree. I mean, you have to understand, we're going in and changing the cellular structure here. This is something that you want.
Amazing.
You want someone that knows what they're talking about to perform this service, and you're changing the cellular structure of your body.
And for us in a small area, like, people using these things incorrectly can give it a bad name very easily. So bottom line is, be truthful, be knowledgeable, Don't just inject something or learn it off, once again, TikTok or Instagram. You need to be educated as an injector, as a provider on these products to be able to give your patients best result and keep them safe, because things can happen, terrible things. Even though this is a fun side of medicine, crazy stuff happens all the time. So
if you guys feel like you found this video helpful or you got the education you were looking for, make sure you subscribe below and leave us a review. And next week, we're going to come back and we're going to kind of build off of this conversation, and we're going to go talk about some biostimulators such as Sculptra and Radiesse.
Yeah. And okay, all the things happening in the aesthetic industry. All right.
Till next time.
Till next time.